Hi everyone, did you know that here in Korea, everyone gets a national health checkup every 1 or 2 years? After your checkup, you'll typically get your results within a few weeks. However, the report can sometimes seem confusing, especially since it's usually written in Korean and contains various test items. But don't worry, you don't have to feel uncertain or overwhelmed. In this video, we'll guide you through your health checkup report step by step. We'll clearly explain the normal range for each test item and help you easily understand what your results actually mean. By the end of this video, you'll feel comfortable and confident, fully understanding your own health checkup results. So, ready to get started? Let's dive in! When you first open your health checkup report, the first page you'll see is titled Overview of Health Report. This section is designed to provide you with a quick and clear snapshot of your health. The Overview of Health Report is categorized into 5 groups. The first is Normal A. This means your health is looking great. No worries here? Next up, we've got Normal B Borderline. You're still in the normal range, but close to the edge. So paying more attention to your habits can help maintain your health. Next is Possible General Health Issues. This means there could be a health concern. So it's important to visit a doctor for more precise tests and necessary treatment. The fourth category is possible high blood pressure or diabetes. Your blood pressure or blood sugar levels are higher than usual, so it's important to see a doctor for additional tests and regular monitoring. Finally, we have confirmed health conditions. This category covers known conditions such as high blood pressure, diabetes, high cholesterol, or tuberculosis. Remember to take your medications consistently and maintain your daily health routines. Shall we explore each key item in more detail? Let's get started. Starting from page 2, you'll find the results from each specific test you've taken. Let's take a look at your body measurements. This includes things like your height, weight, waist size, and blood pressure. We also check your vision and hearing. With your height and weight, we calculated your body mass index, or BMI. This number helps us determine whether you are underweight, at a healthy weight, overweight, or obese. Calculating your BMI is straightforward. Just take your weight in kilograms and divide it by your height in meters squared. If math isn't your strong suit, no worries. There are plenty of easy online calculators that can do the work for you. In Korea, we follow the Asia-Pacific guidelines for obesity. These differ slightly from international guidelines. If your BMI falls between 18.5 and 22.9, congratulations, you're in the healthy range. But if your BMI is below 18.5, that indicates you're considered underweight. And if your BMI is 23 or above, you fall into the overweight category. This group is further divided into different levels of obesity. So take a moment to check your BMI. Another important measure is your waist circumference. Did you know this simple measurement can indicate your body fat levels and related health risks? For men, a waist size over 90 cm and for women over 85 cm can suggest higher risks for health issues like diabetes and heart disease. Wondering how to quickly estimate your waist size? You can refer to your pants size. Generally, men wearing pants size 35 inches or more and women wearing pants size 33 inches or more may be overweight or obese. However, pant sizes can vary a lot by brand or style, so the best way is always to measure directly. Next, let's look at your vision and hearing. Did you know that working in overly bright or dim lighting can strain your eyes? Tasks that require focusing up close for long periods can gradually lead to vision problems. Fatigue, discomfort, or eye strain are signs your eyes need extra care. Please don't ignore these signals. It's not just your vision that's at risk. Working in noisy environments can easily lead to hearing damage. If you often have difficulty understanding what others are saying, frequently ask people to repeat themselves, find it hard to clearly hear the person on the phone, or regularly need to turn up the television volume, you might be experiencing hearing loss. If you notice these signs, it's important to carefully check your hearing test results. Visit a healthcare provider for an accurate diagnosis and professional advice if needed. You've probably had your blood pressure measured many times, not just during health checkups. Blood pressure is the force of your blood pushing against your artery walls. It's shown as 2 numbers like 120/80 mmHg. The top number represents your blood pressure when your heart beats, while the bottom number is when your heart rests between beats. If the top number is less than 120 and the bottom number is less than 80, this is considered normal blood pressure. If the top number is between 120 mmHg and 139 mmHg, or the bottom number is between 80 mmHg and 89 mmHg, this means you have borderline high blood pressure. If the top number is higher than 140 mmHg or the bottom number is higher than 90 mmHg, this means you have high blood pressure. Let's learn about blood tests. Blood tests help us check for critical health issues like anemia, diabetes, liver function problems, or high cholesterol. Let's look at a few key tests you might encounter during your health checkup. Hemoglobin is a vital protein found in your red blood cells. Its primary role? To carry oxygen throughout your body. So why do we measure hemoglobin levels? A simple blood test helps us check for anemia, an important condition, where your body lacks enough healthy red blood cells. If your test shows low levels of hemoglobin, don't worry. Your doctor may recommend additional tests, like an iron test, to decide the best treatment for you. We have the fasting blood sugar test. This test can help catch diabetes early. To get ready for this test, you'll need to fast for about 8 hours, which means no food or drinks. If your fasting blood sugar level is less than 100 mg/dL, this is considered normal. It could mean you're at risk for diabetes or prediabetes. In that case, the doctor may perform additional tests to confirm your results and provide a clear diagnosis. If your fasting blood sugar level is 126 mmHg or higher, it typically indicates diabetes. Next, let's learn about the lipid test. Did you know that lipids, or fats, play a crucial role in your body? While we need some fat for energy and health, too much can lead to serious issues. A lipid test helps us understand how much fat is in our blood. This simple test measures 4 key components. The lipid test usually checks total cholesterol, HDL high-density lipoprotein cholesterol, LDL low-density lipoprotein, cholesterol, and triglycerides, although not all 4 may be tested depending on guidelines. Cholesterol is a type of fat your body needs, but having too much can raise your chances of heart disease and strokes. If your total cholesterol level is above 200 mmHg, it's important to take some extra care. Next is HDL, or high-density lipoprotein, often called good cholesterol. HDL helps remove excess cholesterol from your blood vessels. Aiming for an HDL level of 60 mg/dL or higher is a good goal to shoot for. Now let's look at LDL, which stands for low-density lipoprotein, known as bad cholesterol. This type can build up in your blood vessels, increasing the risk of heart issues. It's wise to keep your LDL levels below 100 mg/dL. Finally, we have triglycerides. These are another type of fat found in your blood, and high levels can also lead to heart disease. Aim to keep your triglyceride level under 150 mg/dL. Did you know your liver is the largest organ in your body? It plays a vital role in keeping you healthy by storing nutrients from the food you eat and detoxifying harmful substances. But how can you tell if your liver is working properly? That's where a liver function test comes in. This simple test uses a blood sample to measure enzymes such as AST, ALT, and gamma-GTP. Elevated levels can indicate liver damage or other health problems. If your liver isn't working well, you might feel unusually tired, have indigestion, bloating, or nausea. A very noticeable sign is jaundice, where your skin and eyes turn yellow. However, liver disease often doesn't show clear symptoms early on, which is why it's sometimes called the silent organ. Regular liver function tests are crucial. They can help you detect liver issues early and manage your liver health effectively. Next, let's talk about kidney function tests. Urine tests check for protein in your urine, a condition known as proteinuria. And blood tests help detect other kidney issues. But why is that important? First up, we have urine tests. These tests check for protein in your urine, a condition known as proteinuria. But why is that important? Normally, healthy urine contains almost no protein. A urine protein test measures how much protein is present. If your results show protein in your urine, it can indicate that your kidneys aren't working properly. Did you know that conditions like high blood pressure and diabetes can increase the risk of kidney damage? This damage may cause protein to leak into your urine. One sign to watch for is excessively foamy urine. This could be a red flag for proteinuria. Initially, you might not notice any symptoms. This makes it easy to overlook potential issues. But remember, if left untreated, proteinuria can lead to serious conditions like kidney disease, complications from diabetes, or worsening high blood pressure. Lastly, we have the chest X-ray. It helps find lung problems, especially diseases like tuberculosis TB. Did you know TB still happens in Korea? A chest X-ray can easily check for this. You've taken a significant step toward understanding your health checkup results. Knowing your health well is the key to a long and happy life. Stay healthy, be proactive, and take good care of yourself. Thank you for watching.